Hey folks, welcome to the reading room. I wanted to chat a little bit about this case of a patient with a mass on thoracic radiograph. So we can really readily identify that mass. It doesn't really jumps out at us on the screen. So we've got this large soft tissue opacity mass. It's occupying the left caudal thorax. This is what we're looking at in this patient. But the question becomes, where is this mass arising from? We might think, hey, that's probably a pulmonary mass. It's probably the left caudal lung lobe. But there are some features of this case that tell us that it's actually coming from a different location, and that's what I want to draw your attention to in this video. So if we look here, what we're seeing is that the rib comes down and then is actually truncated a little bit before we're catching that rib again more distally. So between here and here, there's actually no rib that we're able to see, and there's this large soft tissue mass occupying that region. So what we're seeing there is rib lysis associated with this rib-associated neoplasm. Take a look at that in another one of these projections. It's a similar but different ventrodorsal projection, and then another lateral projection, taking a look at that as well. I find it more challenging to identify that rib lysis in the lateral projections because you actually have to find the affected rib and trace it down. There's a lot of superimposition. It's another reason why orthogonal radiographs are so vitally important in our patients. We might presume that this is a pulmonary mass if we only had the lateral projections and didn't have this really important piece of information from the VD. So once again, things to look for with rib-associated masses is there any lysis of that rib? Can we see any places where it's discontinuous? And that's what we're identifying in this case here. And I hope this has been helpful the next time you're trying to evaluate a thoracic mass in a dog and determine where it might be coming from. Before we go, I just want to remind you of some differential diagnoses for rib masses, the most common ones being chondrosarcoma, fibrosarcoma, and osteosarcoma, but there could definitely be other masses and maybe less likely infectious etiologies like an abscess present causing a similar finding. This was a chondrosarcoma in this dog, and I hope this has been helpful for you in your clinical practice.